the issue of a mandate is purely one of when or if we utilize the Tulsa Police Department to enforce what people should be doing anyway. And we're in the position of doing this, by the way, because the Tulsa Health Department, which has been put under unprecedented strain for the last year and a half, they don't have the staff to enforce that ordinance anymore, like they did last year. Last year, I think they did over 2,000 visits to go out and meet with businesses to educate them on what was necessary to be in compliance with our ordinance. Well, all of that would now fall on the Tulsa Police Department that's down 30 officers from where it was a year ago. And so that's my concern. It's not about some philosophical disagreement with mask orders. I signed one last summer, and if we had our healthcare systems as they did last summer coming to us right now as a group and saying, we need this to stay operational. If you guys don't do this, we may not be able to continue to operate and save the lives of Tulsans. There was no question in my mind about supporting it last summer when I heard that message, and there would be no question in my mind about supporting it if we heard that again. Fortunately, we are not in that position right now. And so there are different, every elected official has to make their own determination on when or why they would support a mask order. And I've heard a lot of people in the last couple of weeks, debating whether or not masks are effective or not. Again, I would go back to being in any emergency room. You're going to see that people who rely on protection to keep themselves healthy when exposed to patients all day long, every shift, they're wearing masks. There's not a lot of debate amongst the medical professionals about the safety and the necessity of wearing them. So again, the only issue for me is that if I'm going to pull a police officer off of fighting crime, especially when we are in the midst of right now gang violence in Tulsa, the likes of which we have not seen in a generation, to pull officers off from dealing with things like that, to go out and educate people on the mask ordinance, that I'm going to have a lot greater sense of urgency from our healthcare systems than we have right now. And hopefully we don't get there. Hopefully the trends continue to go the way they have been for the last 10 days. That I won't hesitate to act if we have to. But right now, based on what I'm hearing, we don't have to, and we can keep our police department deployed fighting crimes all over the city of Tulsa.